Question period. I recognize the Leader of the Opposition.
Mr. Speaker, this tired and out-of-touch government is failing to deliver on health care. We see that in our hospitals, where nurses are holding protests outside, where we have fire code violations in the ER, and we see that in ambulance care. Earlier this fall, we released FOI data that shows that there were more than 1,100 cases when a Saskatchewan person needed a local ambulance, but no ambulance was available. How does the Premier defend that record, and how is that building and protecting Saskatchewan?
Recognize the Premier.
Speaker, we've been on the floor of this Assembly in the Rotunda, Mr. Speaker, speaking to the investments and the recent addition to those investments in ambulatory care, not only in the City of Regina, Mr. Speaker, but across the province, including the rural areas of the province, Mr. Speaker. Ambulatory care or EMS care, Mr. Speaker, is well, if they'd like to hear the answer, Mr. Speaker, I'll provide an answer. It's part of a continuum of emergent care and urgent care in this province, Mr. Speaker. Just earlier today, myself, the Minister of Health, a number of other members of the government had the opportunity to go and tour an 85% complete urgent care centre right here in the city of Regina, Mr. Speaker. In there, not only is there going to be urgent care offered to the citizens not only of Regina but surrounding communities, Mr. Speaker, but also will speak to being that single point of intake for those that may be having a mental health crisis, Mr. Speaker, or may have entered a life of addictions and are looking for some of the recovery supports that are also being built out here in the province, Mr. Speaker. And so investments continue not only in ambulatory care, Mr. Speaker, investments continue not only in our emergency rooms, Mr. Speaker, but investments continue in new and innovative ways to provide health care here in Saskatchewan, Mr. Speaker, ways that really have not been offered anywhere else in Canada.
Recognize the Leader of the Opposition.
Mr. Speaker, we're joined today by professional firefighters and paramedics, and they know all too well the crisis that our first responders are facing. Chronic short staffing means that people don't get the care they need when they need it. And ambulance shift supervisor logs we received through an FOI show just how bad things are, with hours-long offload delays or OLDs becoming the norm. From one of those logs, Mr. Speaker, I quote, "Insane night. The calls never stopped. Olds at RGH all night with 10 patients stacked at one point." Does the minister think that it's acceptable to have 10 patients waiting and for the workload to be insane on the regular?
Hear, hear. Hear, hear. Recognize the Premier.
To the investments that we are making in ambulatory care, Mr. Speaker. Also, investments that were announced over the course of the last week or week and a half in our emergency room staffing, Mr. Speaker, to ensure that we're able to turn those ambulances around, make them available to the community again. Yesterday, the Minister of Health, Mr. Speaker, had spoken to the fact that just in the last 12 months, we have hired, the SHA, has hired 870 new graduate nursing students into our system, into our facilities, Mr. Speaker. On top of that, 410 offers have been made to folks from the Philippines, medical health professionals from the Philippines, 90 of which are offering services and bridging in our facilities here today to help turn those ambulances around, make them available to the community. Mr. Speaker, as I said, we had the opportunity to tour an 85% complete urgent care centre on North Albert Street here in Regina. We look forward to the opening day of that facility in the new year, Mr. Speaker, which will offer additional urgent care services, Mr. Speaker, reducing the strains on our emergency rooms here in the City of Regina and consequently in Saskatoon when that one is built in a partnership with the Takakuk Cree Nation, Mr. Speaker, offering services to the residents not just of Regina but the surrounding areas, getting our ambulances back in service to the community quicker, Mr. Speaker, when you combine that with the most ambitious health human resource plan in the nation of Canada.
Recognize the Leader of the Opposition.
Mr. Speaker, the Premier has professional paramedics in the gallery today. I suggest he put the lines down and listen to these folks. So here's another log from June 15th, and I quote, "Busy night from the start. OLDs at RGH, 3 hours. Pasqua, 2 hours. OLDs just cripple our ability to respond. And this one, Mr. Speaker, from July 3rd. Both hospitals just absolutely overrun at shift change. Very busy night. Down 2 trucks, basically, and lost a crew at each hospital. It's killing crews. Sad face emoji. How much more does this tired and out-of-touch government need to hear before they recognize that this is their record? And it's past time that they listen to the local voices in healthcare, like the nurses and firefighters and paramedics who are reaching out to fix the crisis in our healthcare system.
Recognize the Premier.
Mr. Speaker, 870 new graduates hired into the system are going to help us unload those patients, provide them the services that they need, and make that ambulance available to the residents of not only Regina, but all Saskatchewan communities, Mr. Speaker. The millions of dollars, additional dollars invested in our ambulatory care will add staff to our ambulance services across the province, Mr. Speaker. 410 folks that have been offered, medical professionals that have been offered positions from the Philippines, Mr. Speaker. As I said, 90 of those are in our communities today, are going to help turn those ambulances around, make them available to whatever community they are operating in, which includes the capital city of Regina, Mr. Speaker, and the urgent care centre that we're touring this morning that is 85% complete is going to be yet another opportunity for our ambulances, Mr. Speaker, to access on behalf of the patients that may require their services the care that they need.
Recognize the member from Saskatchewan Eastview.
Mr. Speaker, the Premier is quoting some math, but I don't think many people would find his government's math very trustworthy these days in Saskatchewan. Mr. Speaker, these ambulance logs show all of the bad things happening in our healthcare system under the watch of this tired and out-of-touch government. Here's another one from August 15th, quote, longest continuous offload, 10+ hours. OLDs at both hospitals all day. From September 1st, quote, longest continuous offload, 7+ hours. Wow. General OLD, unreasonable, being all shift, have 8 patients as of this writing. From May 23rd, quote, OLD at both places, both running 2 to 4 hours at a crack. Longest continuous offload, 6+ hours. How is this acceptable to that minister? Why won't he work with healthcare workers to fix this broken system?
Recognize the Minister of Health.
Thank you, Mr. Speaker, and I'll begin by thanking those folks who have joined us here today in the galleries and also who are providing this very valuable service for us as ground paramedics, as firefighters across Saskatchewan each and every day, 24 hours a day, 7 days a week, Mr. Speaker. This government is going to continue to support the people in this gallery and paramedics right across this province. And Mr. Speaker, in this year's budget, we have an $8.8 million increase towards EMS services across the province, Mr. Speaker. The member opposite likes to quote from the ambulance logs, and yes, Mr. Speaker, we do face some challenges out there, Mr. Speaker, but we are addressing those challenges, Mr. Speaker, from those same logs. June 18th, really good night again. July 22nd, steady nights, no offload delays. August 25th, great day overall, good night. September 24th, good night overall, Mr. Speaker. Again, recognizing that we do have pressures, which is why we're making these investments, why we continue to meet with frontline providers, with paramedics, with ground EMS, to make sure that we can continue to build upon the work that's already been done in collaboration with our partners in healthcare, Mr. Speaker.
Recognize the member from Saskatchewan Eastview.
Yes, Mr. Speaker, I do like to quote from those logs, and I've got more quotes for that minister. From July 10th, quote, offload delays at General all night, 5 to 6 deep. From July 25th, quote, longest continuous offload all day, single patient more than 6 hours. OLDs all day at RGH and or Pasqua. From June 25th, quote, tons of ODs. OLD issues at Pasqua despite multiple open rooms. Mr. Speaker, these delays are caused by this tired and out-of-touch government's short staffing crisis in our hospitals. Nurses want to help, and they've called for a task force to fix this. Why won't that minister just say yes to the nurses so we can fix these chronic problems in our hospitals that lead to those long delays?
Recognize the Minister of Health.
Thank you, Mr. Speaker. Multiple topics in the member's question. Once again, I'll focus on EMS today, Mr. Speaker, as we have the guest here in the gallery. Mr. Speaker, as I said previously, this government is making some significant investments into EMS. I talked about the $8.8 million increase for EMS services, $2.6 million for wage parity funding for paramedics working for contracted services, additional funding, a 2% grant increase for contracted ambulance operators to mitigate some of the pressures they're facing, Mr. Speaker, more training seats through Sask Poly and our Saskatchewan regional colleges, Mr. Speaker, adding an additional 100 paramedic paramedic training seats in our post-secondary institutions, Mr. Speaker, to bring more people into that system, Mr. Speaker. We're going to continue to work with our frontline healthcare providers on these initiatives. Here's a quote, Mr. Speaker, from March 24th, and I quote, "It's a great budget for ground EMS. It doesn't meet everything 100%, but that can't happen overnight," says Steve Skowronko, President of the Paramedic Services Chiefs of Saskatchewan, Mr. Speaker. We'll continue to work with our frontline healthcare providers to address these challenges.
Hear, hear. Recognize a member from Saskatoon Eastview.
Mr. Speaker, if that health minister doesn't understand the connections between nurses' concerns and paramedics, then he better give his head a shake and check his notes again. You'd think from everything that he has to say that everything's just fine in our health system, but that's not the case. I'll quote again from these logs from August 12th, quote, "Multiple extended OLDs at both hospitals. Always gotta be these doggone offload delays." And that's not the only dog reference, Mr. Speaker. From September 30th, quote, "OLD bad, longest 8+ hours at one point. 6 of my 9 units were tied up at the general ER, 6 of 9. 2 more tied up at Pasqua, 8 of 9 units tied up at the hospital. That dog don't hunt." Mr. Speaker, will the minister finally admit that when it comes to Sask Party's record on health care, as these paramedics said, that dog don't hunt?
Recognize the Minister of Health.
Thank you, Mr. Speaker. The member opposite wants to talk about the government's record when it comes to ground EMS and healthcare, Mr. Speaker. Well, we'll talk about the record, Mr. Speaker. Here's the record. In February, Mr. Speaker, we announced $2.4 million for 24.5 full-time equivalent paramedic positions here in the city of Regina, Mr. Speaker, to staff 2 additional ambulances and 2 additional paramedic response units, Mr. Speaker. That's this government's investment into ground EMS. Mr. Speaker, when it comes to rural healthcare and rural EMS, where we have a very aggressive rural EMS stabilization plan, Mr. Speaker, adding full-time positions into rural communities and remote communities as well, Mr. Speaker, right across this province. In June of this past year, Mr. Speaker, Waka adding additional hours to its second ambulance to create 8-hour staff, 16 hours on call. June 1st, Hudson Bay adding enhanced staffing and guaranteed 8 hours per day with 16 hours on call. Porcupine Plain, same thing. Q-Park, same thing. Waka, more enhanced ambulance services. Kindersley, Mr. Speaker, adding a second ambulance, Mr. Speaker.
Recognize the member from Saskatoon Eastview.
Mr. Speaker, I do want to talk about this government's record in health care because these FOIs clearly show that this tired and out-of-touch Sask Party government is failing to deliver on health care for the people of Saskatchewan. And that is especially true when it comes to ambulances. But there's hope, Mr. Speaker. The firefighters and paramedics who are here today are asking this government to work with them, open up the Ambulance Act, and collaborate on the changes we need to fix the problems in health care. Will the minister say yes for once? Will he agree to work with firefighters and paramedics to fix this broken system?
Recognize the Minister of Health.
Thank you, Mr. Speaker. Myself as the Minister of Health and the Minister of Rural and Remote Health, as well as members from across the government on this side of the chamber, meet regularly. We meet regularly with frontline providers, with their various organizations, with fire chiefs across this province, Mr. Speaker, and have these discussions around how we can continue to improve ground EMS in Saskatchewan. Mr. Speaker, so we'll continue to have those conversations. My question, Mr. Speaker, would be, what would the members opposite do? What sort of changes are they proposing for ground ambulance, Mr. Speaker? I'd ask for them to put their position, for once, Mr. Speaker, to put their position on the record, Mr. Speaker.
Recognize a member from Saskatoon Centre.
Miigwech, Mr. Speaker, this tired and out-of-touch government isn't listening to people. This government is turning the former SLGA store on Idlewild into a shelter for people with complex needs. Before making this announcement, the Sask Party did 0 consultations with people who live and work nearby. Many of them are my constituents. Why is the Sask Party opening this shelter without doing any consultation with impacted community beforehand?
Recognize the Minister of Social Services.
Mr. Speaker, in terms of our work on homelessness in and around Saskatchewan, Mr. Speaker, we made an announcement a couple months ago now, $40 million in addition to the work being done by my colleague in mental health and addictions. Are always working to increase capacity, Mr. Speaker. 300 more beds total in the province for supportive housing, traditional emergency shelters, and those with complex needs, Mr. Speaker. This is exactly what our municipal partners have been asking for. This is exactly what the police have been asking for, Mr. Speaker. We saw the work being done by City Council last week, Mr. Speaker, in terms of hearing from the community. Mr. Speaker, there was pamphlets and information sent around to the surrounding community, is my understanding, and so we're going to continue to work with the community to help individuals who are most vulnerable out there.
Recognize the member from Saskatoon Centre.
Mr. Speaker, let me be blunt. We need more complex needs beds in Saskatoon. We need more mental health and addiction supports. We need action on housing for people. There's a right way and a wrong way to do this. Help us understand why this tired and out-of-touch government isn't doing any consultation with people who have concerns and questions.
Hear, hear.
Recognize the Minister of Social Services.
Mr. Speaker, we made an announcement around a month ago. I think I maybe said my previous answer an incorrect date. And Mr. Speaker, so we're going to continue to work with our municipal partners who have asked for this for quite a long time. Police have asked for this for quite a long time, a place to put individuals who are having challenges. They're a danger to themselves. They could be potentially danger to the public. So we've come up with this significant investment, Mr. Speaker, to keep our community safe. I talked about the outreach that ministry has done with the business on that particular block. We've worked with the city to get information out to the public. It was out in the council chambers in Saskatoon with a 10-to-1 vote in favour of this coming through. So, Mr. Speaker, we're working very hard to meet the needs of individuals who are struggling, Mr. Speaker. Even her colleague, the member from Fairview, wrote a letter to me that says we need more spaces, we need more dispersed locations, Mr. Speaker. That's exactly what we're doing.
Here, here, here.
Recognize the member from Saskatoon Centre.
Mr. Speaker, people have questions that aren't being answered. So I put them in a letter to the Premier last week. What supports are going to be there? How did the government choose this location? What's the plan for people after their 24 hours in the shelter are up? What supports are going to be there for residents and business owners? When will we get answers to those questions? And finally, what is the contingency plan if this call falls apart?
Here, here.
Recognize the Minister of Social Services.
Mr. Speaker, we know there are certainly challenges out there in our communities with those struggling with mental health and those struggling with addictions, Mr. Speaker. We're hearing about that all the time. Part of the approach to homelessness that we brought forward is to increase the amount of shelter spaces, to increase the amount of supportive living, Mr. Speaker, and we're going to continue to do that. So, Mr. Speaker, we'll work with our community partners. This is what they've asked for. We're going to continue to work on these, Mr. Speaker, and see how this approach works. And we're looking at many approaches to be able to deliver on a way to keep the community safe, but also help those who are most vulnerable.
Here, here, here. Recognize the member from Regina Elphinstone Centre.
Thanks, Mr. Speaker. They're simply not listening. They're not listening to the solutions coming from frontline workers in the healthcare system, from paramedics, whose situation could not be more worse, from concerned Saskatoon residents, and they're not listening to Saskatchewan people who have fair questions about this government's waste of public dollars. Sunrise Motel, owned by a government MLA, where the rate jumped up 50% when taxpayers started picking up the tab. Evelyn checked in at $119 per night. That rate shot up to $200 once this ministry was shamed into picking up the tab. They spent more than $750 to save a $200 damage deposit. The explanation didn't make any sense last week, and it doesn't make sense now. How does the minister justify this waste of taxpayer money? Hear, hear.
Recognize Minister of Social Services.
Mr. Speaker, again, similar to my previous answers, our priority is to help vulnerable people in difficult situations, in emergency situations often in our province, to find them a safe, warm place to stay, Mr. Speaker. And so that's what we're talking about with the provincial approach to homelessness. We also occasionally have to use hotels in emergency situations, Mr. Speaker. So as I've said before, the ministry is reviewing the policy. We're looking at that. We're committed to getting the information the member has asked for as soon as possible, Mr. Speaker, and we'll continue to look at this situation as we move forward. Thank you.
Recognize the member from Regina Elphinstone Centre.
Mr. Speaker, they've cut public housing to the tune of hundreds of millions of dollars. They've manufactured this crisis. Now they have to stick people in hotels and then stick Saskatchewan people with the bill. It's the minister's responsibility to make sure that his ministry has policies to protect the taxpayer and make sure dollars aren't being wasted. We now know $172,000 was paid out to his colleague, the owner of Sunrise Motel, just last year. We've asked for the policies associated with hotel stays to be tabled. Where are they? When will the minister do that? Or does the ministry just not have policies in place to protect the public? Hear, hear.
Recognize the Minister of Social Services.
Mr. Speaker, as I've said before, many times in this House, we are looking at this policy to ensure that taxpayer dollars are used appropriately, of course, but also we want to make sure that individuals who are in a difficult situation, an emergency situation quite often, to be able to find a safe place to stay. Sometimes that involves emergency shelters, sometimes that involves hotels. This is the same policy that's been for many years in Saskatchewan, having to use hotels, and was the same as under the members opposite, is my understanding. So again, in light of this situation, I've asked the ministry to look at policies and procedures around this situation. That work is underway. We're also looking to get, as quickly as we can, the information that has been requested by that member. Thank you.
Recognize the member from Regina Elphinstone Centre.
Mr. Speaker, Saskatchewan people want answers about how this government is wasting public money, particularly in light of this week's budget announcement. It's our job as legislators to hold this government to account. But last week, when I tried to put forward a motion for the provincial auditor to look into this mess, the Sask party voted it down. What a shame, Mr. Speaker. It stinks. Sunlight is the best disinfectant. And at the Sunrise Motel, it's going to take a lot of disinfectant. Why did the Sask party block the auditor from doing a special investigation? Where are the requisitions? Where is Evelyn's damage deposit? Where are those numbers I asked for? What are they trying to hide? Hear, hear.
Recognize the Minister of Social Services.
Mr. Speaker, again, as I said before, reviewing the policy, taking a look at that within the ministry and trying to find best practices, Mr. Speaker. Provincial auditor, as I've said before, is free to review anything that she wants, and that has happened many times in the Ministry of Social Services, even in my time as a minister, and they are free to look at anything to do with it. But it is my understanding, Mr. Speaker, that through officials' communications, that the auditor is in fact going to look at this matter, the policies and procedures around it, in our next cycle of audits, so that work will continue, Mr. Speaker, and the ministry will comply fully with that and work with the auditor just as they have done many times before.
Recognize the member from Regina Douglas Park.
Mr. Speaker, in answers to written questions tabled by this government, we learned that for survivors waiting to see a counsellor after a sexual assault in northern Saskatchewan, the average wait times are 3 to 6 months. Shame. 3 to 6 months of waiting, Mr. Speaker. It's completely unacceptable. We see this government move with lightning speed to pass legislation and act in areas that are their priority, but we see nothing to address these unacceptable wait times. When will we see action from this government to ensure survivors of sexual assault in northern Saskatchewan won't have to wait 3 to 6 months to see a counsellor?
Good question.
Recognize Minister of Justice and Attorney General.
Thank you, Mr. Speaker. Certainly aware of the written question and of the situation. I would disagree with the characterization. $27.5 million we've committed as a government this year to addressing interpersonal violence, and as part of that, $1.7 million, Mr. Speaker, committed to sexual assault service providers across the province, and we would submit that it is making a difference. Of the community areas reporting, which the member opposite asked about, 2 communities do have proportionally higher wait lists. However, even including those 2 communities, the average wait list to see a counsellor at a sexual assault service provider is 36, as in 36 ahead of one in the queue, Mr. Speaker. There's always work to do, and certainly we are attempting to do that, Mr. Speaker, covering the gamut of initiatives that try to address this and the waiting list, at which for some sexual assault services, Mr. Speaker, the wait list is 0.
Why is the member on his feet?
Point of order arising from question period, Mr. Speaker.
State your point of order.
Thank you, Mr. Speaker. As members in the chamber well know, impugning the integrity and honesty of other members is unparliamentary. During question period, the member for Saskatoon Eastview said that a member isn't trustworthy. That's clearly out of order. I'd invite the member to withdraw and apologize.
Recognize the member from Saskatoon Eastview.
Thank you, Mr. Speaker. I withdraw and apologize.